Hello, everyone, and welcome to this audio podcast. Excuse me, this audio podcast as part of a research and report, this audio podcast as part of a lobostics report, and this audio podcast about this audio podcast as part of a ZtormLabostix Productions. Uh, today's audio podcast, we're going to look at an overview from adaptive peer-reviewed and published works from 2000 in around between 2020 2020 2022, and looking at works in regards to ZtormLabostix Collaborative and Health Inequalities and Kidney Care for All. This work was again peer reviewed and published in around 2022. So, a bit of contents in around this overview. So, introduction, look at an introduction, aims and objectives, population and healthcare, shared decision making, challenging inequality, and uh, looking at an overview around the social media platform, two different social media platforms, the RPSG being one, KDOS being second, being a secondly, and then sort of conclusions, a summary, and a reference or citation at the toward the latter part of this overview. So to begin with, a bit of intro. So healthcare is best when there is a position to deliver the NHS or National Health Service long-term plans aim for what have been referred to as triple integration of primary and specialist care, physical and well-being services. Those not familiar, for example, with the those that are not familiar with the NHS long-term plan, there's a document that was published by the NHS from between 2015 and 2019, and being formally published and available document available in from the NHS from in around 2019. So additionally, health and social care, the Health and Social Care Network, or HSCN, should allow sort of untapped areas focusing on education provision surrounding health and disease. HSCN also provides the interlinks to help integrate healthcare services by enabling data sharing. So in around sort of the aims and objectives, the aims and objectives. Number one, to understand whether CKD patients would approach health professionals and patients, health professionals and patients, i.e. those patients or healthcare service users who have been through similar care pathways, for example, through online consultations, and whether this would be welcomed through whether this would be welcomed through social media platforms, and secondly, to understand if and whether CKD patients would welcome joined up integrative and supportive integrative support from health professionals through social media, wherein both cohorts, i.e. professionals, healthcare professionals and patients, again, can bridge gaps across health inequalities. So first announced in 2003, the term or terminology population health was used to describe outcomes surrounding disease trajectories across health conditions. Population health has now progressed to include identifying patients at risk of long-standing or long-term conditions through, for example, epidemiological investigations, or through demographic data and or bioinformatic research to improve healthcare and outcomes. Patients with long-standing conditions use use the internet to access peer support groups through social media, through through also social media. And whilst this can be helpful, peer support alone does not override the necessity for healthcare approaches. So it is in this context patients become either more informed as decision makers or misinformed around disease trajectories, leading to compromised quality of care. So now looking at shared decision making, and there has been published works in around this in more recent times, and in more recent times, and publications, papers, or evidence and documented work can be accessed through databases such as Medline, PubMed, and Embase, for example. The use of information and communications technology, or ICT, and shared decision making is important for most patients because many want to be involved in making decisions about healthcare. There is also compelling evidence that patients who are proactive or proactive participants managing healthcare have better outcomes than recipients who are simply passive recipients of who are recipients who are merely sort of merely see themselves as sort of passive recipients of healthcare. And the use of friendly ICT services, information communication tech services, is also important. For knowledge and resource acquisition and for integrated care. And user-friendly ICT services allow the delivery of healthcare service provision, and quality of care across healthcare sectors. So now looking at sort of challenging inequality. So public involvement and efforts are needed to promote innovation or a sense of inventiveness in and around aspects of healthcare service provision, and aligned to research to reflect public intrigue and values. In line with research and challenging aspects that also in line or aligned with research and challenging aspects that encourage challenging aspects that also preclude inequality. Patient and public involvement, or PPI, has become a main component of healthcare research, or linked into research, as uh, as conceptualized, if you like, originally from the National Institute of Healthcare Research, or NIHR, in around 2014 in the United Kingdom. PPI gives healthcare service users the opportunity to be part of solutions, and to establish beneficial and advantageous healthcare, and tackling inequality through research and involvement. The essential changes are that the belief that involving patients in healthcare leads to improved quality of care throughout and through participation. PPI is also beneficial for researchers or investigators, as it has positive impacts about gaining new insight into work and prompts better understanding of the area under investigation or study. Involvement and interactivity of patients and researchers need to be preceded by the development of guidelines for users integrated into works or a project, and the permission in transferring the expertise and skills between academia and healthcare healthcare practice or practices. So now looking at a sort of an overview and two examples of social media platforms that have sort of that have been that were sort of conceptualized and founded on the premise or basis of PPI, if you like, and sort of before sort of or in the time between where PPI was a sort of a primitive basis in around more of the clinical and medical base and clinical and medical sort of aspects of healthcare, not so much on the side of other practices of healthcare between 2007 and 2014. In regard to the RPSG, or the Renal Patient Support Group, as a social media platform, patients and carers often had various questions regarding kidney care following routine clinical sort of outpatient appointments, owing to the lack of opportunities really to share real life experiences with fellow peers through face-to-face communication. The intention of the RPSG was founded to provide an online support social media an online support group social media platform, initially as part of kidney care received at and within the North Bristol, the North Bristol NHS Trust in Southwest UK. The RPSG was also formally founded in 2009 to help raise CKD, chronic kidney disease awareness on a broadly, sort of broadly, and for primarily for young adults, and all the way up to sort of the more senior the more senior adult renal population or kidney population, and this provides support from ages 18 plus. The social media platform has now grown exponentially and globally. The RPSG has been a support group or social media platform for all who live with this long-standing or long-term condition. Patients and carers are using the RPSG all around the world or globally because involvement and interactivity through the social media platform provides sort of opportunity or broader opportunity for discussions and how patients and professionals and investigators or researchers could be working in partnership to find answers and improve condition and disease and lives of patients with the long-standing or long-term condition. At the same time, being involved also provides potential to become a sort of more inventive or innovative sort of model or basis for shared decision making. And the RPSG is and has been is and has primarily been research active building on evidence base to better the care and lives of patients. So over approaching almost 2 decades, the RPSG have an international administration and research team, and this helps keep the social media platform live and proactive 7 days a week, 24 hours a day. And the RPSG welcomes anyone and everyone to join. So now looking at the social media platform KDARS, that is abbreviation for the Kidney Disease and Renal Support Group, or KDARS Group for Kids. So the Kidney Disease and Renal Support Group, or KDARS for Kids is a social media platform primarily founded in the northeast part of the United Kingdom, in a city or an area called Lincolnshire, around Lincolnshire, and was founded in around 2014, and it was initiated for patients and parents, guardians, and carers of babies or neonates, toddlers, and young people who are living with various forms who live with various forms of CKD, and general renal disease. The social media platform supports pediatrics and young people from ages naught neonate, so 0, from neonate or age 0 to 18 years. And KDARS was inspired by one of the founders' own personal experiences when when a daughter has suffered with acute kidney injury, or AKI, secondary to antepartum hemorrhage during a newborn period. The daughter of the founder was later diagnosed with CKD stage 3B. And for those listeners and viewers who are not familiar with the CKD severity and CK severity, general severity, there are 5 stages of CKD, and CKD stage 3 currently in amongst primary care services. Primary care services have CKD stage 3 is subdivided as 3A and 3B. 3B being more serious, or more of a severity than 3A. Additionally, just to inform, there have been works looking at the some of the sort of contentions, some of the contentions around CKD stage 3A specifically. So additionally, the KDARS team offers sort of online space or social media space for families to communicate, share experiences and stories, offer supportive advice, and especially when areas of healthcare become challenging, and where face-to-face communication is not always possible. The social media platform has also grown exponentially and globally. Confidentiality, of course, is paramount, much like that of the RPSG in KDARS, and what is raised and shared and discussed remains within the closed platform, the closed social media platform. Pediatrics and young people, families, siblings, parents, and guardians required a safe space and secure place to share understanding without the anxiety of potentially feeling compromised elsewhere. The lack of support for pediatric renal patients and families is and has been overwhelmingly obvious in amongst pediatric literature, and young people literature, in amongst evidence and documented works where kidney care practice is concerned, owing to and primarily owing to where the pediatric population is a minority population in comparison to the adult population, with adult population, and those adults who are suspect or high risk and diagnosed with with varying forms of chronic kidney disease. The KDOS team at the same time is and has been bridging a gap that requires more established educational and support support and pathways built into pediatrics and young people's kidney care, safeguarding confidentiality and the security of KDAR's members and families has been again extremely important to the objectives and the mission and mission of the social media platform. The KDAR's social media platform also encompasses a strong administration team who have offered time, to support and keep the social media platform running smoothly on a 24-hour basis. KDOS have admin involved from the UK, parts of Europe and the United States, and this helps keep the and this keeps the group the social media alive and um, alive and active or proactive. So seven days a week. So now looking at some conclusions and bringing the overview bringing this overview to the latter end. There is scope for service development initiatives relating regarding patient care through advice, education, and peer support, but there needs to be coordinated efforts. Service providers should focus attention to how online spaces and social media can improve provision, and healthcare challenges have led CKD patients to investigate or explore sort of new and more effective ways of approaching medical practice or clinical practices, with clinical or medical practices sort of outside the confines of clinical or medical environs, and additionally to see a sense of inclusivity through healthcare integration. Healthcare challenges have led CKD patients to also investigate, investigate and identify practices where there have been sort of shortfalls, and also where there can be more integrated links between pediatrics and young people services and adult healthcare services, where and at least in in line to the specialty of kidney care. So in summary, patients would welcome health professional involvement through social media platforms or online platforms, and future works should look to encourage development of sort of a novelty sort of framework or a novel framework to help preclude health inequalities, and highlight what healthcare could look like healthcare could look like with healthcare professionals and patients, um, uh, healthcare professionals and patients, sort of through online spaces and social media platforms to prompt a sense of best practices aligned um, to the care of young people, young pediatrics and young people, and adults suffering with different forms of varying forms of CKD or chronic kidney disease. This is just as mentioned in the contents. This is a slide that provides the reference or citation, if you like, of the publication, of the peer-reviewed and published works, and of the publication where the more detailed aspects of this works can be identified. That draws this audio podcast to a close. This overview as part of a research and report. This audio podcast as part of a Labostix report, and this audio podcast as part of as part of ZtormLabostix Productions.